Hi, my name's Dr. Schlang. I'm the Chief Dental Officer of Smile America Partners. Today I'm going to demonstrate placing a dental sealant. With me today is Irene Casanova.
Hi everyone.
Irene is the Chief Dental Assistant of California. She's also a trainer in California and other states for Smile America Partners. I'm also with Mariana, who is my dental assistant for today.
Hi.
And I'm also with Alina, who is Irene's daughter. And Irene's going to be my patient today. Before I demonstrate the sealant, let me go over some things that I feel are important and you should keep in mind when you do place a sealant. The thing that I find that is most important when placing a sealant is to have good lighting. And as you can see, I have a pretty good light on my loops. Now, the other important thing is to wear loops. And loops helps you see better and do better work. I do admit that if your eyes are under 40, you probably see pretty well. But loops also give you better ergonomics. The dental materials we're going to be using today are UltraSeal XT by Ultradent, and this is the syringe with the sealant material. This sealant material is not unfilled resin, but it's approximately 50% filled, so it's more like a flowable composite. It has properties that help it adhere to the tooth even at a vertical level, so it's not very runny. That's a helpful property of this sealant material. And for the etch, we're using Ultra Etch by Ultradent, and I like its creaminess. And if you notice, I'm using a light blue tip. The light blue tip is very thin. It's 25 gauge, and I very highly recommend using the light blue 25 gauge tip on both the etch and on the sealant material itself. What the 25 gauge tip allows you to do, it allows you to get into the grooves and place the etch so that it actually flows into the deepest part of the grooves of the tooth that you're sealing. Prior to placing the sealant, you want to make sure that the surfaces that you are sealing are clean. If they're not clean, then the etch has a hard time penetrating and doing what it needs to be doing. When etching, etch for 20 seconds and try to apply the etch to as dry a tooth as possible. When sealing, you want to make sure that the enamel has a frosted appearance before you place the sealant, because if it doesn't have a frosted appearance, it means one of two things. Either that the tooth is moist or that you didn't etch enough. When drying a tooth, you want to make sure that you have an air syringe that blows air without moisture in it. In our program, if you find that there's any moisture contamination to your air syringe, the protocol is to remove the syringe, replace it with the spare syringe, and immediately send it in so that the air-water syringe can be refurbished. For isolation, I usually try to do the upper and lower sealant in one quadrant at a time together. So I will use a cotton roll for tongue isolation to prevent moisture contamination, and I use the dry angle in the cheek area to prevent moisture contamination coming from the upper buccal area. Okay, so I'm going to place a distal lingual sealant on Alina's number 3 and an occlusal buccal sealant on number 30. So the first thing that I want to do is to get isolation, and I'm going to place a dry angle, and then when I work on the right side, what I do is I place a cotton roll, and I ask my dental assistant to hold the cotton roll in place. So I'll place the cotton roll, and I try not to go too far back so I don't gag the patient. And then I remind the patient that it would really be helpful if they breathe through their nose, and that way my work is easier. And then I dry out the grooves. So I'm drying out the occlusal and the buccal groove of number 30. And now I'm drying out the distal lingual groove of number 3. Then I get my mirror and my etch, and I kind of hang on to my air water syringe over my right arm, and I make sure to place the etch as best as I can to limit the etch to what I'm sealing, and not to have it spread all over the tooth. And I'm also working the 25 gauge tip into the grooves. And then I make sure that I etch a full 20 seconds. And after etching for 20 seconds, I flush and dry. And if I feel that there's not an overproduction of saliva, I don't change my cotton roll or my dry angle. If there is an overproduction of saliva, I do change my cotton roll and dry angle. And the most important thing that I'm looking for now is the frosting on the tooth. And as long as I see frosting, then I know I have etched adequately and my tooth is prepared to receive the sealant material. Now, I don't use my amber filter because I don't find it to be necessary, but I slowly, with contact in the tooth, place the sealant material in the grooves and try to rub it in a little bit with the tip. If I see bubbles, I'll try to get the bubbles removed by brushing the sealant tip into the groove. And make sure all my grooves are sealed, and then ask for a cure. We're using a Velo light. The Velo light on its highest setting will cure a sealant in 3 seconds. And we'll show you this a little bit later, but when the Velo light flashes orange on the left, that means that it's on its highest setting. Now with indirect vision, I will seal the upper tooth. Make sure that my grooves are dry and that I see the frosting. Here. And there we have it. So, in review, the most important thing is isolation. Well, good lighting, magnification, good isolation, making sure the teeth are clean, and drying the teeth before etching. Etch for a full 20 seconds, flush, dry the tooth, make sure that you could see the frosting, keep the tooth dry, place the sealant material thinly in the grooves, cure, and you should have a sealant that will last the test of time. And a good sealant, 90% of them will last for at least a year. 50% of them will still be there after 4 years. Thank you very much. Last year we introduced ultra-dense Velo curing light, which I like very much. And one of the features that I really like about the light is that it has a 3-second cure. Right now, the light is on its highest power, and it has 3 powers. It has 1 watt, 2 watt, and 3 watt. Right now it's on 3 watts, and at 3 watts, you can cure a sealant in 3 seconds. And it's set for a 3-second cure. The way that you know that your Velo light is on a 3-second cure setting, at 3 watt setting, is that you can see the orange light flashing along with the green lights. I'm going to put it on the 1 watt setting, and you'll see it's quite different. Put it on the 1 watt setting. I press the button that's below the lights, the flashing lights, and then I release it, and you'll see no green lights are flashing, and you do not see an orange light. And that means you're on the 1 watt setting, and that's a slow cure. To use the curing light, you press the upper button, which illuminates the light. So as you can see on the upper button, a considerable number of seconds go by before it goes out. Now the 2 watt setting is achieved by pressing the button below the lights for a couple of seconds, and you'll notice that the green lights are flashing and the orange light is illuminated, but it's not flashing. This is, let's call it an intermediate setting, 2 watts, 1 watt being the lowest setting, 2 watts being the intermediate one. And it requires longer curing time to cure a composite or a sealant. To cure a sealant in 3 seconds, you put it on its highest setting, the 3 watt setting, And you do that by pressing the button below the lights again, and you'll see that the green lights are flashing and the orange light is flashing. An easy way to remember it is if you want to be able to cure a sealant in 3 seconds, make sure the orange light is flashing. What I recommend that all dental assistants and dentists and hygienists do is to see how hot the 3-second cure is. And in order to do that, I just press the upper button, the button above the curing lights, to turn it on, and see how it feels on my thumb. And you could see, that'll give you an indication of how much heat is generated. In general, when you're using it on the 3-second cure, you want to keep it as close to the composite or sealant material you're curing as possible. But also know that there is a safety refractory mechanism built into the light. So after I press the light for a 3-second cure, if I press again, it won't go on. It'll only go on after a couple of second delay. And that helps prevent overheating the tooth. So once again, this is Ultra Dense Velo light. It's a very durable light. If you drop it, there's generally no worries about it breaking. But also, one other thing I want to point out with the light is that the head is pretty narrow. So it's very important when using the light to make sure that the light is directed exactly at the sealant material or composite material that you're trying to cure. When curing a filling with the light, it generally, even for small fillings, it requires 2 3-second cures, and for large fillings, 3 3-second cures. And if you're using a Tafelmeyer matrix band, you always need to cure after, once again, after you've removed the band. The thing that the light enables you to do is to cure fillings and sealants much faster than we did before, and it's always nicer to, especially if you have multiple procedures to do, that you're not spending an inordinate amount of time with the curing light. Well, that's the Velo light, and for those of you who don't have the light, we're rolling it out as fast as we can. Thank you very much.